Nigeria's Ebola virus status has risen from 13 reported earlier this week to 15. The Minister of Health, Professor W.H.O, told a news conference in Abuja that 2 new cases have been confirmed in Port Harcourt. According to him, an ECOWAS staff who had primary contact with the Liberian-American, Mr. Patrick Sawyer, evaded surveillance and traveled to the city.
You recall that the last time we had this interactive session, we told you the number was 13, so we have moved from 13 to 15. You also have noticed that these additional 2 were not treated in the isolation ward in Lagos. One of them is a primary contact of the index case. This primary contact of Mr. Sawyers had evaded our surveillance team in the last week of July 2014 and traveled out of Lagos to Port Harcourt.
This ECOWAS staff, who is currently not having symptoms of the virus, is the second recorded case of the disease in the city. He's, however, been placed under strict surveillance in Lagos. Meanwhile, the widow of the doctor that secretly treated him is currently being quarantined after developing symptoms of Ebola.
Because the widow is now symptomatic, she has, since yesterday, been quarantined, pending the outcome of laboratory tests being carried out today on her.
Government has urged the public not to panic while pledging for cooperation with health instructions to help reduce the spread.
What does it take for us to just respect a simple rule? You are under observation because you may have a primary or secondary contact or even a tertiary contact. Why? What is wrong if you simply for that period, obey the rule? Because we can only defeat this disease with citizens' cooperation.
So far, 15 cases of Ebola have been recorded, including the index case, Mr. Patrick Sawyer. 14 cases have been managed, with 7 discharged from the hospital, 6 deaths and 1 current case being treated in Lagos, 6 under surveillance in Enugu, 70 in Port Harcourt, and 141 in Lagos.